thank you all for your considered questions, for volunteering to be in the forefront of this evening's program, and we appreciate you being citizens and volunteers. So your gift for this evening is a thank you. Okay, now the next what we're going to do is we've received a large number of written questions. We've received a large number of written questions. We're going to fish them out of here at random, with the exception of about 8 or 10 that are on the top that tell personal stories. And then we're going to pull those off the top one at a time and intermix them with the questions. And then, if it's not already been answered, then we're going to go ahead and ask that person to stand up and give a brief statement. Congressman Driehaus and Jessica both said that they like that system. So, Mr. Altman, you want to choose one of these? Now, if we pull a question that was just answered in response to the panel, please don't think that we're screening or censoring. We're just going to move on to something that has not been asked. Okay. This is a question that I have and on my mind as well. In light of the death of Senator Kennedy, do you either feel that his absence will act as a catalyst to bring the sides back to the table to pass health care reform, or will it serve, in fact, as an impediment?
I believe that people will keep working in the Senate in a very bipartisan fashion. Obviously, Senator Kennedy was known for working across the aisle with Republicans and Democrats on the committee. And he's obviously very knowledgeable about health care issues. But I think that there are a lot of members on the Health Committee and in the Senate who are very knowledgeable about health care issues, who have worked on a bipartisan basis. And I think that everyone is committed to getting health insurance reform done. So we'll continue to try to do that.
I didn't see many of the funeral and everything that went on. However, I did hear a few comments from other senators, and I heard it from Republican senators. So when those folks are laughing about bipartisanship, I encourage you to listen to Orrin Hatch. To listen to Senator Orrin Hatch, to listen to Senator John McCain. And they repeatedly will tell you that Senator Kennedy was known for the bipartisanship. But what Senator Kennedy was also known for was incrementalism. And he achieved a tremendous amount during his 47 years in the Senate. And it was done not through huge programs, but they tended to be more incremental steps. It wouldn't surprise me at all if when we got back, we stepped back and again looked at more incremental approaches to this. And I think we should all look at what we can achieve and continue to move forward. Some people would suggest we need, to pass it all right now. That may or may not happen, but Kennedy achieved a lot through incrementalism.
Here's a question that'll make some people happy. We have already spent trillions on cap and trade and stimulus. Why should we trust government with our health care when Medicare, Social Security are bankrupt?
Well, a couple things. The Medicare system, from an administrative standpoint, is actually more efficient in terms of its administrative costs than many private businesses. There are absolutely challenges facing both Medicare and Social Security, and that has more to do with demographics than anything else. If you look at the population of the United States and you look at demographic charts, there is a line going almost straight upwards from 2011 on. There is not enough money in the system in terms of revenues coming in versus receipts going out in both Medicare and Social Security to sustain that. That's something we need to get our arms around. Now, there are inefficiencies in Medicare and Medicaid, and we absolutely, and just, you know, I toss these Medicare and Medicaid, and I know we all toss them around, but for those of you that aren't familiar, Medicare is a system that covers everyone over 65. It's seniors, senior care. And Medicaid is a partnership. Medicare is funded by the federal government through your payroll taxes. Medicaid is a partnership between the state governments and the federal government. All right? That covers the aged, blind, and disabled is one category, and then low income. 70% of the costs in Medicaid go to the aged, blind, and disabled. It's what you see a lot in nursing homes, when people have to get rid of their assets in order to qualify for Medicaid in nursing homes. But 70% of the population using Medicaid is the low incomes. So, just so you've got clarity on that.
I was just going to make one point on this. The World Health Organization recently released a report about healthcare in developed countries, and in a lot of those categories, in infant mortality, in suffering from, or success after suffering from a heart attack or stroke, all these different healthcare categories, the U.S. did not rank very high in healthcare quality. But the one area that we ranked, one of the areas that we ranked really high in, that we actually ranked number 1 in, was healthcare for people over the age of 65. So Medicare is doing a pretty good job. It has some financial. That we have to deal with and that we are trying to deal with in health reform. But it is a good program that takes care of a lot of people. And as Senator Brown said this morning, he's not aware of Medicare denying health care because of a pre-existing condition or because of your gender or because of where you live, like private insurance companies do. So
Sir, we're not going to take questions at the very end. So this next question, the next...
Your rule was, that was my question, and your rule said if you didn't answer it, I could ask a follow-up. Right? That was your rule.
The question was answered, sir. The question was answered. Okay. Sometimes people don't like the answers they hear, but the question was answered. And Steve, I'll tell you, this is not an easy question. It's two parts. First, will you support a bill to include a public option? And part two, do you accept campaign contributions from either the insurance or healthcare lobbies?
I'll take contributions from the audience if you want me to change You know, I accept campaign contributions from a lot of organizations, and I'm sure I have. I've received contributions from lobbyists and healthcare organizations. Yes, I'm sure I do. And it's because of the way our system is put together. It cost me about $2 million to run a congressional campaign, which I think is obscene. It's unfortunate that we have to do that. In terms of the public option, I can support a bill with a public option, but it's more than the public option. I want a bill that's a good bill, and if it has a public option and it's a good bill, I'll support it. I don't mind, in the Senate version, they don't have a public option, and if we can achieve the same thing that's trying to be achieved through a public option in another way, I'll support that. I don't know that that's doable, but I'm going to look at all of the components of the bill, not just the public option, for my support. I don't exclude a bill because it's got a public option, absolutely not. If the public option helps us move forward in reducing costs and providing universal coverage, then yes, I can support it.